at JPM, we're primarily, I think the smallest system we're listening to is maybe a billion, but there's an awful lot of others that didn't receive that funding that maybe are struggling. Are they just out and out acquisition targets at this point, or are they going to be able to claw their way back?
If you think about it, in the old world, they'd be acquisition targets, and primarily the ones that are partially healthy or ones that could really benefit by a larger provider partner who can provide academic physician staffing or some scale around supply chain. But I think with these other issues in our previous discussion a few minutes ago about the move away from acute care and inpatient beds, I think it's got to be a combination of the country needs a rationalization. How is care delivered? And the industry's talked about for years, right? More telehealth, true hub and spoke. How do you actually deliver care? And these insurers are talking about delivering care. I think it was Cigna that talked about actually whole person health and delivering virtual primary care, virtual chronic care, virtual behavioral health care. So these new technologies providing for rural areas that this will become available to them. So what do you need? What do you need in your community? Certainly like an emergency department or some kind of capability, but do you now have to move to a hub model where you need to travel a bit for surgery of some type? It's just the reality, I think, of the economics of where we are as an industry, or these rural providers will need to be subsidized by the government, which also might be a good use of funds, basically, if the business model can't sustain them. But I don't know that they're acquisition targets. And the attitude of the Biden administration has been to actually crack down and put more scrutiny on these acquisitions by health systems of other providers. So there's a regulatory headwind there as well, when it's probably the right business decision for some of these struggling providers to look for consolidation partners.